Welcome to Buffalo's Healthy Communities Show, filmed right here in Buffalo, New York at the Apollo Media Center. I'm Phil Haberstroh, the host from the Wellness Institute of Greater Buffalo. We've got a super show today, something very exciting that we want to share. We're going to talk to you about the projects that are being done by the Population Health Collaborative. And my guest today is Mr. John Craik, the CEO,
Good to see you, Phil.
Chief Executive Officer, and keeper of the mission of the organization. John, welcome. It's great to have you here.
Great to be here, Phil. Yeah, great.
So before we get into the Population Health Collaborative, which was formerly the P2 Collaborative, how about sharing a little bit about John so our audience gets to know you a little bit?
Sure. There's not too much to share, although I did pass a milestone recently. I've just realized I've spent now just more than half my life in Buffalo. So I'm not a Buffalo native. I was born in Brooklyn. Only lived there for a few years though. My father's from Scotland, so I lived in Scotland for a bit. But spent most of my life growing up in the Finger Lakes. So I'm basically an upstate New York hick.
But you've got a sensitivity to rural communities.
Absolutely, yeah. I grew up really in farm country, dairy country in upstate New York. So yeah, very, very rural where I grew up, in spite of being born in Brooklyn. After college, I moved to Boston, Massachusetts, lived there for a couple of years, and now I'm not going to do the math because then your viewers might figure out how old I am. I don't want to do that, but I am. I've just more than half of my life now I've been spent in Buffalo. So and it's great. It's home now, and I don't see myself going anyplace else.
And I know you've got a lot of background in nonprofit management. A little bit on that, yeah.
Yeah, a little bit. It's funny. I actually started working for a New York State Assemblyman shortly after I moved to Buffalo, Bill Hoyt. So the late great Bill Hoyt, I worked for several years. And then after that, I practiced law for 2 years. Wasn't a great fit for me. I wasn't a very good lawyer. I didn't enjoy it. Kind of got back into the community work and have been lucky enough to be the executive director of a number of organizations in a number of different sectors. So education, social services, human services, and now population health, which hopefully brings everything together.
That's super. Well, let's talk then a little bit about the Population Health Collaborative, how old it is, its mission, whatever you want to share with the audience there.
Sure,
John.
thanks. Yeah, we're, let's see, what are we, 16 years old now.
Okay.
We were created originally, we got a large grant from the Robert Wood Johnson Foundation, and at that point it was a multi-year grant that helped us do a number of things around creating diabetes registries and some breastfeeding initiatives and a few things like that. And a lot of what we did early on was really in the clinical area, so working with doctors and practices to address a lot of the issues they were working with. And as you know, Western New York has a lot of serious health and chronic disease issues. So that's kind of our genesis. And we kind of zigged and zagged for a few years, and what we've done now is we've really tried to position ourselves where we bring together the payers, so the insurance companies, the healthcare providers, community-based organization, and employers. So we're all these different sectors, all these different players and stakeholders in the community care about the community's health. We try to bring them together and have them working on the same sorts of things and rowing in the same direction.
So in a simple sense, the mission is to improve the health of the population of Western New York? Is that a fair statement?
Yep, and I'll go on and kind of finish the whole statement to make it official, but by aligning the stakeholders. Okay. So we're not running programs ourselves, but what we do is bring together different people and different entities and organizations that are running their own programs. And again, as you know, Western New York can be so siloed, having them work together more closely and having them to agree to certain goals and objectives and standards and measures. And by doing that, again, we're not creating anything new, but we're improving what's already in existence.
And let me put that in the context then, John, of a challenge. Have you been able to bring the stakeholders together the way that you'd like to in your vision for the future?
Yes and no. So getting the stakeholders together is the easy part, and we have a terrific team, and we've done and when I say we, it's not me, it's the people, the staff at PHC, but brought together a lot of different stakeholders to do things like network and share information, learn from each other, share best practices, and that frankly goes really, really well. It's a very collaborative collaborative, very open, very welcoming community. So that's been going extremely well. We haven't yet asked anybody to change what they're doing. So in terms of aligning the stakeholders, right now we're in the playing nicely together stage. At some point, I think frankly people will have to play better in a more meaningful way, not just collaboratively being nice to each other, but actually doing things together. And that, I think, by definition, is going to require some organizations and some people to change, and that's when it's going to get a little bit more difficult.
Challenge.
Yeah.
But you've been architects of, I'm a fan of the social capital picture
We know that.
in the United States, and building trust and relationships with organizations.
And it's funny because I say we don't run any programs, and sometimes people kind of scratch their heads and what does that mean exactly? But the fact that we don't run programs means we don't have any skin in the game. So we don't have any agenda. We're not trying to sell anything to recruit new clients or customers or patients or anything like that. The only thing that we're really beholden to is what we as a community agree we should be beholden to. So by being that neutral player, I think that helps us with relationships, and I think honestly we have a good reputation for integrity and trust, and really sticking to again, really trying to do the best thing, not doing the best thing for PHC.
And that's a foundation to the organization's ability to be successful in the long term in that context. In terms of stakeholders, I know you and I have talked about this in the past. The private sector, the public sector, the nonprofits, and the citizens. Yeah. How is that coming? Are you able to bring them all into the room together?
And it's really funny. We are, and for a bunch of reasons. There are a lot of things happening in the community. There are coalitions now about everything. I know you laugh because you know that.
Yeah.
So we and it gets at some level kind of silly, but we're bringing those coalitions together. So we're a coalition of coalitions. Some of those, most of those are very good about it involving people from the community themselves, community-based organizations and not-for-profits. Government is starting to step up and showing a lot more interest in population health issues. We're still lacking, and you and I have had a lot of conversations about this, we're still lacking a little bit with some private sector leadership and some business leadership, but we have on our board, for example, people from Rich Products and Harmac, and a few other local businesses that are very, very community-oriented and community-minded. So we just need to harness them a little bit better.
And for people that are watching right now, John, can they go to your website and find out how they might get involved?
Absolutely, yeah. We encourage that, and we're gaining a little bit momentum. We've been working on something, and we'll talk about that later, but what we've been working on the last few months, people are starting to approach us now and say, hey, can we get involved in this, which is a very good sign, and we never say no.
And that's a segue that we're going to use now. We're going to take a little bit of a break, but please come back because John is going to be sharing with you some exciting news about a new community-based effort to improve the health of the entire Western New York community. So stay with us and we'll be right back.
You've messed up your son's haircut.
Mom?
Do you A, try to fix it?
Like it never happened.
B, work with what you got? Or C, show solidarity?
Thank you, baby.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
So there you are, shuffling through a stack of resumes and you come to mine. This is it, first impression, my way in. But can my resume show you how I truly stand out? Like that I was studying, going to night school while working 2 jobs just to help my parents pay for groceries. Or being the first one to always step up. No, that's something you just can't put on paper. Look beyond the resume and discover new ways to develop great talent that is dedicated, hardworking, and determined like me.
Welcome back to Buffalo's Healthy Communities Show. I'm Phil Haberstroh, the host, and my special guest today is John Craik, the Executive Director of the Population Health Collaborative of Western New York. John, I know that you've got 3 years now and in the job, and you've got some exciting news to share with the community about a new initiative that you're going to be launching.
Yeah, and it's fun because it's been a real work in progress for about a year now, and we're learning more and more. But it might help with just a little bit of history. So every once in a while, you Google and you find out who's doing interesting, exciting things. And San Diego County in California popped up as an organization or a community that was doing a lot of successful population health work. So kind of on a whim, I found out who was in charge of that, called the gentleman. His name was, and it was funny, just a quick aside, his name was Nick Macchione. I'm calling San Diego, and he had this real thick New Jersey accent. He was from New Jersey. I thought that was kind of funny. But he talked about how they had been really addressing a lot of chronic disease issues in San Diego County, and he was quick to point out that people think of San Diego and you think of this affluent, fit community, and he says it's really, if you look at the whole county, it's actually not always like that. There's a lot of working class and lower socioeconomic communities. It's much more diverse than a lot of people think. So they really had their issues, and he mentioned kind of in passing this model called 3-4-50, and I took my notes and a few weeks later looked at that and said, oh, what's this 3-4-50 thing? So we did some research, and 3-4-50 is it's a model or a framework, so it's not a program, and I always stress that we're not trying to create another program, but it comes out of the Oxford Health Alliance, which is Oxford in the UK, and they do a lot of population health work. And the idea is that if you can address 3 behaviors that create 4 chronic conditions, those behaviors and conditions drive 50% of the mortality in a given community. And part of what's very, very attractive about the model is it's very intuitive. So I ask people, doctors, what are the 3 behaviors you could change to improve chronic disease rates in Western New York? And I ask man off the street, and people always know. So tell me, Phil, tell me.
Physical activity,
right?
Nutrition.
Yep.
Tobacco use?
Very good. So see, I knew you'd know. I'm preaching to the choir. So those are the 3 behaviors that create things like heart chronic disease, cancer, lung disease, diabetes, all these related conditions, the 4 chronic diseases that in most given communities account for 50% of the mortality, including early mortality, so premature death. In Western New York, it's actually 90%. So in Western New York, 90% of the people who are dying earlier than they should, it's completely preventable, really preventable. So that's part of what gets me really excited about this, is it's going to take a long time to move the needle on those 3 behaviors, but if they can, we're literally saving lives and adding lives.
Let me go back to your conversations with the Live Well San Diego. What kind of progress had they made? What kind of metrics were they able to share with you, John?
So two answers to that. San Diego's been doing it now for about 10 years, and there's
great.
Which honestly, it's funny. It sounds like a long time, but it's not enough. They've been moving the needle a little bit on heart disease and some other chronic conditions and diabetes. The real research really comes from the Oxford Health Alliance, and they had done 25-year studies in 3 different communities around the world, and they showed that really dramatic decreases in things like heart disease and diabetes. And the idea is that you address all 3 of those behaviors at once. So instead of having there be a smoking cessation program and a physical activity program and a healthy eating program, to the extent you could have all 3 of those behaviors at the same table with the same marketing, the same language, the same outreach to doctors and employers and everyone else, that really improved the prospects of moving the needle on the behaviors and on the diseases.
So in some respects, the evidence from the United Kingdom and the Oxford folks is that you have to be comprehensive. Right. And you have to be strategic in that element, and that means getting those stakeholders at the table.
That's exactly right. Yeah, and part of what's fun about it, and again, what I get a little more than a little geeked up, is it's not creating a new program. I know I've mentioned that a couple of times, but what the model really says is really there's a number of different things you have to do. First of all, you have to get doctors involved, and I talk to a lot of doctors, and I tell I ask the doctors, are you doing a good job changing your patients' behaviors around these 3 behaviors? And every single one of them says absolutely not. And they're not paid for it necessarily. The system's not set up for it. They don't have the time to do the things they need to do to help change patients' behavior. So that's a big piece of it, is the doctor piece. Another piece is marketing and public relations, having PSAs that are consistent. How much exercise should you be getting? Should you be eating
physical activity?
Thank you. You're right. Physical activity. What are and aren't the right types of food to eat? Because there's so much information and so much disinformation. People really aren't clear. So to have a much clearer message would help. And then getting the whole community involved, like community-based organizations and employers. So if you had employers that encouraged healthy eating at the workplace and, taking the stairs instead of the elevators. And as silly as it sounds, it's those small little things. If you can get enough people making just a tiny little change in their lives, the change of the community is really pretty powerful.
And I want to go back, John, to one of the three elements, which is the tobacco picture. And as you know, we've made real progress, both in the country and in New York State and in Erie County, and specifically in reducing use of tobacco. But most recently, we've been challenged by this vaping epidemic amongst our children. And so that would be something that would be included in the tobacco elements, I'm thinking.
Yeah. I mean, and yes is kind of the answer to that question. But the tobacco is a real good example of how initiatives like this can move the needle, and I'm glad you brought that up. So if you think about smoking in the 50s and the 60s, in the movies you saw Cary Grant and Audrey Hepburn, they made it look really cool, right? I mean, it was a cool thing to do. People didn't know it was unhealthy. Doctors, if they told you not to smoke, it was maybe a comment. But the way we drove down tobacco and smoking rates in the country was by having doctors get more involved. Media, you see those really, really moving PSAs on TV about people smoking. Movies now, the heroes, the cool people in the movies and TV shows, they don't smoke anymore. And policies, that's another big piece, is policy, systems, and the built environment. So things like not letting kids buy tobacco, not letting tobacco advertise on TV, taxes on tobacco product. So all these things working in concert together, you can see smoking rates in the country dip from, I think it was in the 50s and 60s, back in the 50s, 60s, and
48% here in 1964.
And now it's like 15% in Western New York.
Yeah,
so
and the counties are still a little higher, Erie County and some of them.
Higher than New York State. Yep.
So
but again, it's a terrific example of how, and again, this is what 3450 does, is it looks at all these different, the policies, the systems, the marketing, the doctors, all these things working together with the same goal and the same metrics. That's how you can move the needle. So that's what we're hoping to do.
So branding the new initiative will be Live Well Western New York?
Yeah, and so going back to San Diego, it's interesting. So in San Diego, it's called Live Well Western New York. And then what we learned is there are other communities, and there's probably about 10 or 12 different communities, and they're all using the Live Well name for the 3-4-50 model. One of them, the entire state of Vermont, has a Live Well Vermont initiative, all framed around 3-4-50. And really close to home for us is Allegheny County, Pennsylvania. So that's Pittsburgh and the surrounding environments, which is very, very similar to Western New York. There's Live Well Allegheny, which again is their name for their 3-4-50 initiative.
And John, one of the challenges you and I and others are aware of in the community for these kinds of positive and health-enhancing initiatives is resources. You gave me the look on that. What is the challenge there? Are we able to get the investment we need to do the work?
Yeah, I guess the answer is we'll see.
Okay.
Right now, and we're in the early stages of reaching out to some stakeholders. We're going to do, identify someone to help us come up with a really, really evidence-based plan to implement that. And we're very, very grateful. We've received a nice planning grant from the Health Foundation for Western and Central New York, which is helping us with that. Down the road, we'll certainly continue to need New York State involved in a meaningful way, other foundations, and then the employer community, because we talk about people and the health behaviors of people. Those people end up being workers in the workforce. And honestly, we like to find a large group of very enlightened employers who can recognize that the health of their workforce is a direct, has a direct impact on the health of their businesses.
And I think that's very powerful, because from at least my work in the community over the years with the Wellness Institute, I know, John, we've made good progress with our school districts.
Right.
having district wellness policies. And on the other side of the age span, there is the age-friendly Erie County, age-friendly Buffalo initiatives, and so on and so forth. So if we can bring the workplace into the across the lifespan mix of the Live Well Western New York, I think we're on our path to a healthier future.
Absolutely, yeah. You know, we keep saying that, you know, people don't live in their doctor's office. It's you know, depending on who you read and what, but only something like 20% of your health is impacted by clinical interventions.
Sure.
So if you know, you're changing your life where you live, work, play, worship, if all of those things are changing, then the doctor becomes somebody who says, yeah, keep it up, and you maintain your health.
So John, as we wrap up here today, what is your sense of opportunity here and things that people can do to get involved or contribute to the success of this Live Well Western New York initiative?
Yeah, so and I think you're going to be able to post our website. So if people can contact us at Population Health Collaborative through the website, it's pretty easy to do. Again, if anybody says we'd like to get involved, we don't say no, you can't.
We have the Western New York Healthy Communities Coalition, which Karen Hall heads up for you.
That's right.
And that's an ongoing piece of this framework.
So we need to hear from people in the community. It's like, you know, what sorts of things can help them make the changes they need to make. We need to hear from community-based organizations that are involved in this work. You know, who's moving the needle and having a measurable impact, who isn't, and why or why not. So we need to work with those people. We certainly need to work with government and policy leaders, people who can do things to change really the context in which people are making these health behaviors decisions. So really, we really need all hands on deck, and again, we're not going to turn anybody away.
And recognizing too that you talked earlier about leadership from the private sector, that's an important piece in any successful community initiative. Getting the elected officials, the policy pieces that support things like complete streets and things of that nature in the framework. So if we think about the time, you know, this is not going to McDonald's. It's not going to happen overnight, right? What is your sense of that?
And I think I shared with you. I get a little bit corny, but I did come across a Greek proverb which really resonates with me. It's community or societies become great when old men plant trees whose shade they will never sit in. So the impact, the effects of what we're doing, we might not see in our generation, but you know, that's in my mind all the more reason to get started right away. It will take a long time.
Beautiful. Well, John, thank you.
Phil, thanks for having me. It's great
for hearing your leadership in this. And ladies and gentlemen, we're here today with John Craik from the Population Health Collaborative, and he's talking about Live Well Western New York. We'd love you to be involved wherever you are in your communities. Please go to the website and contact John and join the movement as we try to work together as a community to improve the health. And again, thank you to the folks here at the Apollo Media Center in Buffalo, New York. Mayor Brown and his team for all their support of our efforts to be a healthy city and a healthy region. Have a wonderful day.